Trachoma is a bacterial disease of the eye, and it has a devastating effect on an individual's family, and on communities. Repeated infections lead to severe trachoma, an incredibly painful and awful way to lose your sight. This sort of project really shows the unique role of the Task Force for Global Health in being a neutral convener, but yet the catalyst that can bring together partners and the very people themselves, bringing them all together in order to achieve something that looks like a miracle, but is actually the result of hard work.
Our work is driven by our values, the value of global health equity, that people everywhere, even the poorest people in the poorest country, should have the equal access to the means of good health.
I think leadership begins with caring. We've had that kind of leadership at the task force. People who really care about health equity, who care about disadvantaged communities and countries, care about children and the health of children. They know what it takes to solve problems.
With polio, you can keep hidden for longer.
The meeting in Bellagio in 1984 that gave birth to the task force was an extraordinary meeting. And this meeting, it was a huge step forward on the problem of raising childhood immunization rates around the world.
It's almost impossible for me to understand the implications of those 2 days in March of 1984. I mean, how in the world do you get the head of WHO, the head of UNICEF, the head of UNDP, the head of the World Bank, the president of the Rockefeller Foundation? How do you get all of these people to agree to meet on something like immunization? So we could have left there without any agreement at all. And I don't know what would have happened. We still would have had smallpox eradication behind us. But when you look at the speed with which immunization was improving, it was far too slow. And so I don't know what would have happened, but I'm quite pleased with what did happen.
The immunization levels were really stuck at 20%, and it meant that 3,000 children were dying every single day, children whose lives could be saved if they could raise the immunization rates from 20% to 80%. And the task force was an organization and an approach that got these organizations to work together and to collaborate effectively, and they pulled off a minor miracle.
Everything was changing. It was changing so fast that in 6 years' time, Jim Grant was able to announce that 80% of children had now been reached by at least one vaccine. And at the Summit for Children, September 30th, 1990, he said, "This is the greatest peacetime effort that has ever been made in the world."
Well, the task force began with concerns about immunization rates and using the technology available to prevent vaccine-preventable diseases, largely in Africa. But that extended to the use of life-saving drugs and the drug donation programs with Mectizan and others to prevent and eradicate diseases which can be eliminated from the world.
The headquarters of the Task Force for Global Health in Decatur is a very ordinary-looking building, and it wasn't even until 2.5 years ago that we even put our name outside on our building. It really stemmed from Bill Foege's injunction to us. He said, if you want to build successful partnerships, shine the light on your partners and not on yourself.
So we have a very modest and small building here, packed full of people, standing room only, and you wouldn't know by driving past, that we coordinate the activities of many thousands of people in the field and provide service to hundreds of millions of people, literally hundreds of millions.
One of the great features of the task force is that it puts its principal resources into program delivery and not into building a major organization top-heavy with administrative expense. It is completely dedicated to the delivery of global health services to the most needy around the world.
I think the task force began to flower and emerge to a place where now it's without peer in terms of public health around the world. It occupies such a unique place. Just a remarkable fulcrum between the resources, not only scientific and pharmaceutical resources of this country, and the work in the developing world. I think the genius of Mark in this has been not only to continue the vision that Bill had and the sense of excellence and scientific credibility, but to bring to it a compassion which established the task force as a credible presence in developing world. But I've just watched with awe, not just amazement, literally awe, at the way in which this is developed.
When we try to quantify what we do, the numbers are hard to imagine. They're really extraordinary. The number of people who will not be blind because the river blindness was cured or prevented, or they didn't get blinding trachoma. When you think of the numbers of children who can grow up awake and alert because they don't have intestinal parasites, by organizing and collecting data and information, we now have the capability to understand the problems of the poorest and the most vulnerable. To know that we're contributing to that improvement by our programs both over the history of the task force and even just the programs that we're doing today, it's an extraordinary privilege.
Definite. This is training people in the field, in the job, to do the epidemiology investigation. Now, Definite is more than 62 programs around the world with about 85 countries involved in these networks.
Intestinal worms are one of the most common widespread infections in humans. There's estimated to be more than 1 billion people infected and some 800 million children who are at risk of infection. There's a magic in the air when you get people together focusing on solving a problem that affects the health and development of millions of people.
I think the task force has had a focus since its inception on developing collaborations. And I think it was that focus that was one of the reasons why the drug donation programs developed the relationship they have with the task force. And it is the drug donation programs that are really the major drivers of the neglected tropical disease programs. Without those donations, the programs simply wouldn't go.
Since we're talking about billions of people with the infections that have to be targeted, there are many challenges in delivering the medication that has been donated. And the problems that arise are then shifted to those operational research teams, and a lot of that is coordinated from here at the NTD Support Center.
The task force, we're approving over $1 billion worth of drugs every year, donated. And actually mass drug administration is now seen as a sort of standard tool for hitting the diseases that affect what we often call the bottom billion. Mostly the poorest populations, mostly the populations with no political voice, no economic voice. These are the people who need the drugs most, and we have over a period of time developed systems of getting drugs for mass drug administration in those very remote communities.
Trachoma is one of the diseases that the task force works on. they're characterized, these neglected diseases and the vaccine preventable diseases, they're characterized by really now affecting people who live in the faraway corners of the world, beyond the end of the road, living a life often forgotten about and without hope. Not all of our partners and not all of the people we collaborate with have the ability to come here, and it's a commitment. It's not easy to actually get out here. And for me, it's a personal privilege. With trachoma and with the other neglected diseases, we don't have to wait for anything. We're not waiting for a vaccine. We're not waiting for a new technology. We know what to do. We know how to do it. We know where to do it. The issue now is getting together in partnership to bring the resources, the donated drugs, the human infrastructure, the volunteers who do all the work on the front line, to bring them all together, and we can consign diseases like this to the wastebasket of history. It can be done. We can get rid of these things, and conditions that have tormented humanity throughout history can themselves become history.
As
a child, my friends and I were all victims of trachoma. The suffering was terrible. When I became a health worker, I could bring the intervention program to my village. I look at this beautiful girl. Her eyes are clear. She's free of this disease. The children are not suffering as we used to suffer.
I see a much, much more expanded and more important role for the task force going into the future. As more and more organizations, more and more foundations, more and more businesses enter the field of global health, there's more and more need to bring them together, to get them to collaborate effectively, and to take what is a very dispersed business and to get it to be convergent. That's exactly what the task force does. That's exactly what's going to be needed more and more into the future. I think we can have a bigger and bigger impact.
I think for Pfizer and the task force, one of the things that was really important about the task force's contribution for us was that they really brought other players to the table. Pfizer had started the ITI as an independent nonprofit, and we decided to house it at the task force, and really at that point we're able to take the program to scale. And I think that could be very much attributed to the tenets that the task force supports around partnership, around believing in the possible, around breaking down barriers.
Going back to 1984, the origin of the task force was all around increasing immunizations in Africa. They actually achieved their goal by the end of 1990. The task force then went on to do other things in pharmacophilanthropy and public health informatics and healthcare strengthening, but they wanted to come back to their roots, and so that was the origin of starting the Center for Vaccine Equity.
So when we met in March of 1984, the coverage for immunization was very poor. For measles, it may have been as low as 10% of the children of the world. And measles was the single most lethal agent in the world. It was killing over 3 million children a year. I mean, an incredible toll. And when you think of 3 million couples having dinner at night missing a child, then you start understanding what this actually means. It's not 3 million children, it's 3 million families that are suffering.
Well, immunizations in many ways can be the leading edge for achieving health equity. Immunizations are simple to deliver. They are widely recognized as important. They have visible and dramatic impact. We're involved in several different projects, including supporting the endgame strategy for polio eradication, which includes introducing inactivated polio vaccine in all countries in the world where it's not being used currently, and next year a switch in the types of oral polio vaccine that we'll be using.
The switch itself is not really unique. We've switched from one medical product to another worldwide. The unique part of this is the whole world has to switch at the same time, simultaneously. You can imagine how difficult that is. I can barely get my 3 kids to line up in a line on any given day, much less 156 countries and nations and regions with their own politics and priorities. The meeting itself that we had at the Task Force for Global Health was to bring partners, workers, scientists, as well as logisticians and program managers, bring them all into our room to explain this to them, to give them the rationale, give them the appropriate tools to help facilitate the switch so that they can take these materials and then implement them in their own countries as well as their neighboring countries.
The advantages of working with the task force is that you're working with a group of people who are experts, bringing together, as taking place this week, a training involving 60 people from 30 different countries. They're able to kind of almost miraculously bring together content, meetings, and do that with a very diverse group of partners, whether it's geographically diverse or in terms of the organizations that they represent, and be able to just quickly make things happen.
For me, one of the strengths of the task force is the staff. The individuals that we have here at the task force, they're mission driven. They have been in search of a place to apply their skills, their knowledge, and this passion for global health, and a journey to make an impact in the lives of others.
I've stood in hospital settings in developing countries and watched babies dying by literally several per hour. What I came to learn was just frightening, that in this hospital setting, they had a 40% mortality rate of children within the first 24 hours of admission. So in the course of a 1-hour meeting in the pediatric ward, standing there with health professionals, we're watching babies die. I had colleagues, these are doctors, leave crying. They couldn't take it. It's like, this is an outrage. And I think so finding where you can do something that's actually productive has been one of the challenges, but we've worked at trying to keep those faces and those problems in mind and take action.
One of the key areas is determining what are the causes of child death in poor countries around the world and what can be done to alleviate those deaths. We think that many of them are preventable, and the total is somewhere between 6.5 and 7 million deaths in children that are potentially preventable. A key element of that is an informatics system of organizing data, of getting the information you need, making it easy to analyze and interpret and share with other people. And that's an area in which the task force has excelled with its Public Health Informatics Institute.
The Public Health Informatics Institute has always talked about information management. It's not the old public health style of simply collecting lots of data and keeping it in siloed databases and looking at it annually. That doesn't work in the 21st century, and the Public Health Informatics Institute has really been a catalyst for thinking about information management. How do you use that information? What's the point of collecting this information? How are you going to use it to make people's health better?
A new Bill and Melinda Gates Foundation funded initiative called CHAMPS, which is the Child Health and Mortality Prevention Surveillance Network. It's a major initiative of the Gates Foundation, and this initiative is aimed at going to those places in greatest need of the highest infant mortality and changing them. But it's probably one of the most significant global health initiatives in our lifetime. This is very, very important. This is at least a 20-year initiative. The Bill and Melinda Gates Foundation is willing to put the support needed over a long period of time to actually determine why kids are dying and then using that information to come up with interventions that changes it. And then once changed, to do it in a way that that change remains.
For a long time, people differentiated global health from domestic health. So people in the United States thought that global health just meant health of people in other countries. But we think we can learn lots of lessons from global health and bring those lessons home. Lessons that would benefit us as we try to improve our own healthcare system. We're part of the world. We have a lot to learn from the world, and global health has a lot to teach us.
Because we're now seeing that even in the poorest countries in the developing world, diseases that are not infectious are becoming more and more important as causes of death.
Chronic health problems like diabetes and obesity and heart disease, where the mortality is enormous in the developing world and where the line is flattening in the more economically developed countries. This upward curve is going to be a major problem. So we have started to tease out those questions.
Fortunately, the past 30 years has brought to the task force core capabilities that are needed for us to take the next step forward. We know we're going to move into noncommunicable diseases. Noncommunicable diseases are problems that require cross-sectoral collaboration. Again, the task force, because of our history at bringing people together, acting as a convener, acting as a group that helps crystallize an understanding of a problem and coalesce action. That's really the right formula for tackling and making progress with that.
I would certainly not say it's any coincidence that the task force is located here in Greater Atlanta. The fact that we are finding ways to create alliances, to create cooperative agreements and arrangements in order to tackle issues that are plaguing not only the world, but even more locally plaguing our country and our communities.
Well, I think the fact that the task force is located here in Atlanta also gives it a special advantage. You know, Atlanta is a city that for many, many decades has demonstrated how different groups coming together can really accomplish great things. If you think about what happened with the civil rights movement, what's happening now in global health, and the task force, you know, I think in some ways has benefited from that heritage, but it's also contributed a lot to that heritage.
So we have a very rich city that has many resources, and the task force is really helping to bring all of these organizations together to work on global health issues.
My interest in the task force has been stimulated again by my contact with Mark Rosenberg, who is one of my heroes, and who has the capacity for having people see problems beyond just the numbers and having people see problems in terms of the faces. The whole issue of compassion in public health, not moralizing about public health, but the extent to which compassion is such an integral part of what people do in public health.
Well, I think compassion is really a key foundation of the task force, the desire to really make a difference in the lives of people, a meaningful difference in their health, in their environment in which they live in, and their ability to provide for themselves.
I think the task force does an incredible job of making sure that we never forget the faces behind those numbers, and that we carry that in our hearts and in our minds as we go about doing the work that we do.
These are very good examples, living examples, good evidences where we have seen, we have witnessed, the communities can really change and they can transform their own lives and their children's future as well.
I can't begin to describe the impact of the work. When you see the faces of children, when you go into the villages and hear the stories from the parents, the community, it's really breathtaking.
The results of this entire effort are so mind-boggling that even though I've been watching global health for 65 years, I continue to get enthusiastic just seeing what's happening. It used to be that we lost 50,000 children under the age of 5 every day in the world. I mean, imagine that. We're down to about 16,000, a third in my lifetime. That's still far too many. It's obscene to have to lose that number of children. But when you see the improvement, it takes defining your last mile before you do anything else. Because gradually the things you thought could not be done are being done. I grew up with the phrase, seeing is believing, only to find that was backwards. Believing is seeing. If you believe in something, you are going to be able to see it. Because now you have a vision of what does that last mile look like.